Your pelvic floor sucks. And I don't want you to take my word for it. Lindsay Mumma is going to let us know it doesn't have to. And we're going to be diving into the science and understanding of how early movement patterns during that first year of life shape our health and keep us from peeing our pants later in life. But don't worry, it's not too late. She's going to share her passion. And even though you've heard things might be common, it doesn't always mean it's normal. So let's dive in and learn together. In our most sleep deprived moments, our children will teach us exactly what we need in order to learn and grow into who we were created to be. These are the loving lessons we will learn whether we were wanting to or not. I'm Irene Googe, your sleep coach, and I'm on mission to educate parents on how to help their young children sleep. Welcome to the journey. Hey there, and welcome to the Loving Lessons Learned podcast. I am super excited to share that today I have Lindsay Mumma, who is a DC DNSP and is the owner of Triangle Chiropractic and Rehabilitation Center in Raleigh, North Carolina. Her private practice focuses on the rehabilitative chiropractic care across the lifespan with a specific focus on prenatal and postpartum health. She is wife, mother of 2 boys, speaker, life enthusiast, and author of the Trimester Series and the best-selling book, Your Pelvic Floor Sucks, and the top 50 in the Health Substack publication, Dr. Lindsay Mumma's newsletter. Thanks so much, Lindsay, for being here with me today.
Happy to be here. Thanks for having me.
Yeah, and I am loving this book.
Thank you. I love seeing that you have the little tabs in there.
I have I'm like, oh my gosh, I have questions. I have like so many things that I've been like thinking about. And I don't know if you remember when we first originally met.
I'm trying to remember what year it was. It was at the Halloween party that TAPS had. It was like a Halloween event, and there were a bunch of us there who were kind of working in the birth and prenatal and postpartum space. And we had our booths kind of like right across from each other. But was that 2018, 19?
It feels like years ago.
It was a long time ago.
It was so many years ago. And the one thing that really resonated, and you were the first person to ever tell me that, like, you know what? You shouldn't be doing Kegels. Kegels are not the right or best activity to do for your pelvic floor. I was like, what do you mean? Because that's all I knew.
This is just a normal thing that I bring up in conversation the first time I meet someone.
I love it. And I was like, she's my people. I was like, tell me more. And then not only did you tell me that, but then you had us practice doing these bear crawls. And I tell people about this all of the time. So I'm wondering if you can share with everyone tuning in a little bit about why we might not need to be doing Kegels.
Yeah. So the event that we were at, I got to kind of lead a little small group through some prenatal and postpartum core health exercises. And one of those that you're referencing is a bear crawl. And the reason why that is an appropriate core stabilization exercise is because it's part of the movement sequence of the first year of life. So DNSP is not a 4-letter thing after people's names that anyone knows what that means. That stands for that I'm a certified dynamic neuromuscular stabilization practitioner, which that's a very big mouthful. Dynamic neuromuscular stabilization actually comes out of the Czech Republic and the Prague school there. So Prague is kind of like Mecca for any manual therapist. Some of the most like profound thought leaders in manual therapy have come from Prague or go to there. Like there's just it's like Silicon Valley for tech people. All of the big leaders of what it is that we can do with manual therapy. So manual therapy is when we're putting our hands on patients in a therapeutic way. So massage therapists can fall under this category. Even some SLPs can fall under this category. OTs, PTs, chiropractors, osteopaths. And then, now we're actually starting to see some medical doctors who are wanting to put their hands on patients because they realize that that's a huge part of the entirety of Western medicine that is really aggressively missing from their treatments. And so manual therapy means that we're putting our hands on people. So dynamic neuromuscular stabilization, or DNS, came out of the Prague school. So there are a bunch of really impressive thinkers in terms of evolutionarily speaking, we have come to this place in society where we can actually live for a really, really long time period, but not necessarily as healthfully as we used to be able to, because we're hunter gatherers. We just live in a sedentary society. And a lot of the problems that people face now aren't because tigers are attacking us or we're warring with other groups, although obviously that does still happen, but we'll save that for another topic. But because we're our lifestyle is impacting the way that our physiology is able to express itself. And so sitting is, incredibly deleterious to our health. The and unfortunately, we're starting to sit kids earlier and earlier and earlier, which is once again kind of just detracting from their overall health. So from a biomechanical standpoint, which that just is referring to the body is alive and the mechanics of its movement, DNS serves to kind of explain and then apply treatments in a way that allows the first year of life to be the guidelines for how we should be moving. So whether you were born in Poland or Prague or Pennsylvania, it doesn't matter. I don't know why I picked P's, but whether you're born in any of those places, you found your way to a bipedal locomotion. And the way that you found that, first you began rolling from side to side, and you need to be able to roll to both sides, right? So these are things that we look for in our babies, rolling from side to side and doing so equally, having appropriate sling activation. So like from your right shoulder to your left hip and left shoulder to right hip happens with sideline. So a lot of parents know that they need to have their baby in tummy time. We actually recommend that babies spend about a quarter of their time on their belly, a quarter of their time on their left side, a quarter of their time on the right side, and a quarter of their time on the back. And unfortunately, most babies are just getting a lot of time in their plastics. So they're being sat in their car seat. They go from the car and the car seat to the stroller where they're still in the same exact position. And then they go from the stroller back into the car. Then they go from the car into the house and they're asleep. So we leave them there. And they spend hours upon hours in this kind of C-shaped position, which is not helpful for their spinal development. And then because they haven't had time on the floor, and because as Americans, we're impatient, we sit our children before they're able to sit down. So, a 5-month-old sitting in a bumbo seat, which, quote, helps them sit, actually ruins their spinal posture. So the first year of life is how we develop our spinal curves. It's how we develop what will become our fully formed hip sockets. It's how we develop what will become our fully formed shoulder sockets. So these ball and socket joints that actually weight bear in the first year because we're crawling, those get really beautifully developed. But if we aren't doing those things because we're spending all of our time in car seats or in bumbo seats, please just get rid of those if you have them. Don't give them to Goodwill because no one else needs them either. Exercisers, same thing. Johnny jumpers, the whole deal. If you're looking for Christmas gifts for people who are going to be having a baby or have recently had a baby, don't buy them devices to put their children in because they don't need them.
I say bring a blanket.
Bring a blanket. Let them lay on the ground. Please give them more floor time. But anyway, so in that first year of life, what's happening is core and pelvic floor are actually starting to synchronously work together. The diaphragm begins to load in a postural way around 3 months old. So if you think of if you picture in your mind tummy time for a baby, and you picture a baby with their forearms down on the ground and they're lifting their head up, that happens around 3 months of development. And it needs to happen because that's the first time that the diaphragm is actually being used to upright the spine. And so this is crucial that we can actually have appropriate lengthening of the spine and appropriate loading of the entire abdominal wall. So that means across the front of the belly, in the sides, around the back, the entire abdominal wall getting load appropriately, and then having opposite arms and legs moving and giving the rolling to allow to lead to being up on our side a little bit higher than on our side, all the way up on our hand, and then loading on hands and knees. And, we have this idea that our babies should be sitting and crawling at 6 months. That's actually completely a farce. They begin sitting and crawling between 8 to 10 months. And we're so impatient for these things to happen. Worldwide, I recently took a course, it was a DNS pediatrics course, and they shared some research. Worldwide, babies are walking 50% of the time by 14 months. And that statistic
Mm.
is so much different in America. I don't know exactly what it is, but there's no way that only half of our babies are walking by the time they're 14 months, because parents will grab them by, like, give them their finger so that they can help walk their baby. And they think they're helping, but they're actually destabilizing the baby's entire torso. They're preventing them from earning appropriate core stabilization. So then it's no wonder that by the time those children who didn't have time to crawl and roll and actually ambulate and then get to a bear crawl, they become adults and they have low back pain. And even before having children, they have incontinence when they do exercises. And anyway, that was a very long answer to your question. But the point is
No,
that
no, go ahead.
these movements in the first year of life really set us up for success. So what I discovered, because I was lucky enough to have a DNS instructor as one of my mentors when I was in chiropractic college, and so I got exposed to DNS when it was actually kind of in its infancy. It was only something that had been taught for about 2 years before I was able to start studying it. And now it's come such a long way. And, if people are kind of in, uh, I really don't necessarily like the term life hacking, because it's strange to me, but Peter Attia, who is kind of a life hacking MD, if I could, kind of bastardize what his actual, all of the gifts that he brings to the world. But he wrote the book Outlive. And that was that's been a best-selling book. And it brings about a lot of information on stability. And he mentions DNS in there,
Yeah.
which is really, really great, because he has found that the way he'd been a lifelong exerciser and he was doing it without any stability. So he just kept getting injured and injured and injured. Well, the same thing happens to women after having a baby. They don't ever actually fully recover core stabilization. So then if they don't have core stabilization, they end up with a lot of pelvic floor dysfunction. And then they also end up with additional injuries like knee injuries and shoulder injuries. And they're not a knee or shoulder problem. They're just related to core stability. So a lot more people are starting to understand that it's important the way that we breathe. It's important the way that we hold ourselves. It's important the way that we do a squat. It's important that we have a squat available to us, And so
Yeah.
this is important during pregnancy, because, Ina May says that if you squat 300 times a day, you'll have an easier labor. I don't know if that's true, because I don't know that we have like a control group versus non. But
Not
if you
everyone's doing their
have,
300 squats.
right, and if you have length and strength in your pelvic floor, you'll be so much healthier. Well, you get length and strength in your pelvic floor in the bottom of a squat. You get length and strength in your pelvic floor in a bear crawl. So that's how we got back here, because I made you do a bear crawl, and it was like, here's an alternative to doing Kegels. And everybody just thinks that you're supposed to do Kegels. Well, at minimum, 1 out of 4 women has pelvic floor dysfunction of some sort. So if Kegels worked, we wouldn't have this sort of epidemiological problem of pelvic floor dysfunction. And it
Yeah.
seems like something you can just laugh off, like, oh, yeah, I just tinkle a little when I sneeze. Well, that puts you in a nursing home, because if you
Yeah.
can't control your bladder, not a lot of people are willing to clean urine off of all of their furniture. So it
Yeah.
becomes a real quality of life issue later on. And if we prepare ahead of time by simply restoring core stabilization, which we all have inherently built within us, because no one taught us how to roll over or how to sit or how to crawl or how to walk. And if they did it inappropriately. Our brains have this pattern within them. And so our brains recognize appropriate loading strategies, but most people learn inappropriate loading strategies, whether it's from a coach or a Pilates class or a yoga class or strength training. It doesn't matter. If they don't understand the core and the pelvic floor need to work synergistically, then anything they do on top of that is going to be done with compensation.
Yeah. So much good information. So I see the passion, and this is kind of what got me so excited. I was like, she like tells you everything that you really need to know and understand.
Bit
And
of an
then
oversharer.
what's been so fascinating is that I've read Peter Attia's book as well.
Mhm.
And I was like, oh my gosh, Lindsay said this and Lindsay said this.
Yeah,
was
I would
like,
just like to state that my book came out before Peter Attia's. So when I was reading Outlive, and I was like, I said this in my book. He read my
I said
book.
this first.
I actually said this before. I didn't rip him off. Okay.
Okay. But I was just like, these concepts that you were sharing, and it has made me pause as someone who, when I was working with children in the daycare center, like really allowing them to move their bodies and do what they need. And I was really fascinated coming to your office and learning more about DNS and how part of your support that you share with moms is like, let's get on the floor and do tummy time with baby. And I now share
Mhm.
that with moms. I'm like, let's do what our babies do. I'm like, look at
Yeah.
how much work this is.
It takes a
Um,
lot of work.
I'm wondering what you say to the parent that says, my baby just doesn't like tummy time.
Yes, I
This just feels
understand.
really hard.
Yeah.
What do you say to them?
So
What
I'm really,
support do
really
you have for
direct with
them?
people. I have a really loving way of nagging people when I'm not even around them. So like I don't know what that is. I wish that I could understand this gift that I have, but they hear me saying like, no, put your baby on the ground when I'm not with them. And so I it's just I think maybe they can feel how much I care about this, because people think like, oh yeah, well, my right foot just turns out a little bit. That's just how I was born. Well, it's not how you were born. That's how you moved in your first year of life that created your hip socket. You weren't born with asymmetrical hips. You grew into them in the movement patterns that you had. So there are so many things that we can do to support a baby's appropriate development. And so many of the things that we have done prevent our baby from appreciating those things. Because if you've been holding your baby all day, like baby wearing is a wonderful alternative to a stroller. Baby wearing should not be a way of life. And that tends to make some people upset, because attachment parenting is like it has really good ideals behind it that, when we're well connected to our baby can thrive. That is 100% true, but that does not mean that you are not still individuals with needs. A baby has a need to be interacting with gravity. So that baby on the ground is actually needing that. You have created that they, quote, need to be attached to you, but they don't need that. They want that. And we as adults can understand the difference between wants and needs,
For
but
sure.
our baby doesn't necessarily have that cognitive capability of recognizing the difference between the two. So if you're someone who's been holding your baby upright, your baby has like a greater view of things, can see more things, can be more interested in things, has more things available to them visually speaking. And, we're talking past 6 weeks, because in
Sure.
those early couple of weeks, developmentally speaking, the baby doesn't have as far of a view. And it's actually really important that you are close face to face with your baby. But if you've had them upright and you haven't had them on the ground, then they're now limited by what they can see. They can't see everything around them in 360 degrees because they're on the ground. What that forces them is to use their curiosity to actually create appropriate motor development patterns. So if they want to see what's behind them to the right, well, now they need to actually activate their deep neck flexors, which are teeny tiny little muscles, but they help to keep our head upright. And if they don't do that because you've been holding them upright and their head's just kind of there, well, then they start to get too much activity in their posterior, the back part of their neck muscles. And when that's imbalanced, then they'll create more tension inappropriately. So instead of giving your baby what they want, which is, hey, hold me and do things for me, right? Like if I just got to be held and do nothing all day, I wouldn't be mad
That'd
about
be
that,
great.
right? But I also wouldn't have good muscle tone. I wouldn't have appropriate cardiovascular health. I wouldn't have any amount of joint health, because I would just be passively being held all day. And so that the first year of life, babies need to be on the ground, because if they're not on the ground, they can't form their joints appropriately. And there's no going back from this. So
Mm.
if the problem is that parents want to multitask, and we actually know that we can't multitask. You can't be from your brain, you cannot be actually doing multiple things at the same time with full presence. So we want to be cooking dinner and taking care of the laundry and all the things that we have to do while we're snuggling with our baby. But that just means that we're doing one or the other. So we can have the baby
Yeah.
attached to us and be fully present with the baby, or we can have the baby attached to us and be distracted while we're folding laundry. It makes
Yeah.
a lot more sense to me if I lay my baby beside me while I'm folding laundry, so I can fold the laundry and I can look at my child and say, oh, I see that you're frustrated because you're on your stomach and you don't want to be laying on your belly right now. I get that. I'm going to keep folding laundry so that we can keep our house neat and tidy. Right. Like, and I have honest conversations with infants all of the time as well. So that is not in a nutshell, but that is what I say to parents. This is the most crucial time of your baby's life, and it's crucial for you to be present for it. And I get that your life is fast paced and it's challenging to keep up with all of the things that you used to do just to take care of yourself, and now you have another person to take care of in your family.
Yeah.
But we can't be having our babies just attached to us or sitting in those plastic devices, because if we're not giving them time on the floor, their core and pelvic floor are not developing appropriately. Their muscles are not developing appropriately. Their joints are not developing appropriately. And I'm the same way stickler about tummy time as I am about pacifiers. I get it's way more convenient for you to have your baby here and stick a pacifier in their mouth. But that's not good for their orofacial development. That's going to actually ruin their breathing mechanics as well. So, like, I get it. That makes it hard. And usually, if your kid hates tummy time or your kid is completely attached to a pacifier, you usually, if you decide that you want to make their life better and you're willing to sacrifice a little bit in order to do that, you've got 3 real rough days ahead of you, because your
Take it
kid's going
one
to be
step.
screaming, right? But like, your kid's going to be screaming because they're on the ground and you have not given them the ability to be on the ground yet. And you've given them a full purview of everything they can see, as far as the eye can see when they're upright. And so when you're telling them, hey, this is all you got available to you is just the ground and however far you can get yourself lifted up here, but they'll actually earn movements better that way. And if you take the pacifier away, you've got 3 real rough days ahead of you, but you're improving the way that their hard palate actually forms the shape of their face and actually allows their airways to expand enough for them to be able to get healthy oxygenated blood to all of their tissues. When I put it like that, it's like, of course I'm going to put my kid in tummy time. Of course I'm going to take the pacifier away,
You're like,
right?
yes, we're doing all the hard things.
We're doing all the
But,
hard things, and
but
there's just convenience comes at a cost, and the cost, unfortunately, for most of the first year of life, is your baby's physical development. So when you
and
hear
health
me say
issues.
that, it's like, okay, well, I guess we're in it.
But I think so many things that you're saying, like, when I'm helping families with sleep, one of the big issues is like, if we don't get that right kind of movement in, how can we expect our little one to sleep?
Yeah, they're not
You know,
tired. They haven't exhausted themselves.
and so
If
they
I don't
have
work
to,
out, I don't sleep as well. I need my
and
body to move so that I've expended some energy.
and there's a lot to learn to trust our
Mm,
bodies. And I think we've moved away so much from like trusting and tuning in.
yep.
And that's definitely one of the things I've been learning in my personal journey. But I think kind of to what you're saying with parents is like trusting that our little ones are capable and that they
Yeah.
can learn this and do it. And it's really beautiful to watch it
When you
unfold.
see autonomy happening in your child, it's such a gift. It's
Mhm.
really amazing to see how capable they really are. And if, parents don't give their children the gift of boredom, then their children can't exercise creativity. And if we
Yeah.
don't give them the gift of time spent figuring out how to navigate getting that thing that's too far for me and actually earning the movement patterns that allow me to get there and grasp it and bring it to me, we're robbing them of a lot of life's experiences.
Mm. Lindsay, in chapter 2, you talk about breathing, which is like foundational, and you come back to this
Yes.
many times throughout the book. And we know that we should be doing some diaphragmatic breathing.
Hmm.
And I'm wondering, there was something I had learned that babies naturally are belly breathers, but
Hmm.
over time they pick up from us as adults where they're not breathing
Yeah.
properly because they're picking up on our stress. And you talk about sucking in, and I feel like I was like, oh my gosh, I'm feeling very convicted because I spent a
She
lifetime.
caught me.
I was like, oh man, she's talking right to me. And I was like, can you talk a little bit more about that? And then, like, at what age do you find that children are actually like starting to pick up our breathing patterns? Because I think I've noticed that, especially with my kiddos, like I can tell with toddlers or preschoolers sometimes where their stress and anxiety is coming in. And we know about mirror neurons. I don't know if you
Yeah.
can kind of talk to that a little bit.
Yeah. So mirror neurons is exactly what I was going to talk about, because it's not, movement patterns aren't hereditary. You don't walk with like a funny sort of gait because your dad does and you like inherited that from him, but you watched him walk and that helped
Mhm.
to create that movement program for you to then follow. And so it's less about the joint shape of your dad's hip as it is about the way that you watched him walk around the living room, and that impacted what you were then able to express.
Wow.
So the mirror neurons certainly play a role. I don't have a really good answer for you of at what age are children kind of picking up on those patterns, because I think from like the start of their life they're picking up on our patterns. And
Mhm.
I there's a bunch of just kind of ideas about birth order. And if you're a firstborn, you're like this. And if you're a secondborn, you're like this, and third, and whatever. I just think that that's a reflection of the evolution of the parents, because most first time parents are very reserved and overly cautious and borderline helicopter or full blown helicopter parents, because they're nervous. They don't want anything bad to happen to this beautiful creature that they brought into the world. And so the firstborn children tend to be a little bit more cautious than their younger siblings. Well, because their parents were cautious. So they learned caution because that was what was around them all of the time. Whereas the secondborn, you're like, oh, I'm not going to break this. Okay, yeah, live your life. That's cool, right? And you're just so much more
Yeah.
laid back as a second time parent. Even as, I remember my midwife saying, I wish I could give the confidence of a second time mom in labor to a first time mom. She was like,
Yeah.
but you got to earn it. And it's true. But
That's such an interesting perspective. Like, yeah, I
yeah,
guess I never really thought about it, but yeah, that totally makes sense. I could
but
totally see that in my family.
you can do this because you
Mhm.
already did it. You can parent because you've already kept someone else here, right? Like,
Yes.
yeah, you're probably going to drop your baby. I tell that to all of my parents. You're not a bad parent. Something's going to happen. Your baby's going to fall off of something. Please be cautious, but you're not a terrible parent if you drop your baby. Everybody
I
does it.
I dropped my son. He rolled off the bed. Yes.
Yep. See? And
We
you
all
will
do it.
absolutely just destroy yourself because you're like, I'm the worst parent ever. I've dropped my
Oh, I
baby.
know.
But it happens to every parent. So I tell them that as well. And I'm like, look at this beautiful, perfect baby. You're probably going to drop it. And they're like, what?
Like, I've
It's
worked so
going to
hard
happen.
not to.
I know. But when that happens and you're a second time mom, you're like, oh, dang it. Brush it off. you know?
Yeah.
So my point is the kind of like repetitive things that your babies are seeing are what they will emulate. So whether that's characteristics or whether that's movement patterns or whether that's breathing patterns specifically. Excuse me just a second, I have to call. Pardon me.
Yeah.
So they will they'll learn those things by watching what their parents are doing. And so the people who are around them the most, they'll learn those patterns. So babies, when they're first born, they actually are shallow chest breathers. They've never used their diaphragm for actual breathing. They had everything in utero given to them through the umbilical cord. So you'll see practice breathing in utero. Like if you're looking at an ultrasound, you'll see that the baby is practicing breathing, but they're not actually breathing, right? Their lungs are filled with amniotic fluid. They take their first breath when they come out of the uterus and when they come down the birth canal and they come out into the world and they take their first breath. That's the first time that they've really exercised the diaphragm as a muscle. And then as that expands, so babies have really, really rapid initial breathing, right? They take short, shallow breaths and they're just kind of like cycling through these breaths quickly. It is our job as parents and caregivers to help down regulate them. So when we're holding them, that helps to regulate their heartbeat. It helps to regulate their breathing rate. If we are not good breathers and we're mouth breathing and taking breaths up into the chest, then our babies are going to learn that. So I think to answer your question from 10 minutes ago, I think that at a very early age, they're starting to pick up on this. But then as they begin uprighting their diaphragm at 3 months at 3 months of age, they start to initially upright the diaphragm and upright the thoracic spine, the upper part of the back. That then gives the diaphragm all three of its functions at one time. So the diaphragm functions in breathing. It functions as a sphincter, which keeps the stomach from going above the diaphragm as it does in a hiatal hernia. And it functions in posture. So the first 3 months are basically spent getting the sphincter function, which that's part of the reason why babies are spitting up. They're starting to regulate their diaphragm and figure out the difference between what's in my esophagus and what's in my stomach, and actually create that sphincter function to be appropriate. Then we start to add in the postural function of the diaphragm. So the postural function of the diaphragm is what then we can exercise intentionally later on in life, which gets really, really developed from 3 months on, as the baby is starting to be able to create central stability so that they can then go and reach for things. So at 4.5 months, a baby can actually cross the midline of their body. They couldn't do that before because of what's happening in their brain and also because of what's happening in their core. So babies are learning to actually get enough stability to bring them to an upright position, which happens kind of across the first year of life. And like I said, 14 months is half of babies worldwide are walking. It's certainly much higher in the United States. But so that their breathing mechanics then are beginning to get ideal in the first year of life. When we have diaphragm on top of pelvic floor, the diaphragm lowers, the pelvic floor lowers. That means the abdominal wall expands. The abdominal wall can't expand if we have our rectus abdominis, those two six-pack muscle bellies that are sitting on either side of your belly button. Those muscles, the ones that, when you think of quote abs, you think of those. When those muscles are contracted and holding our abdomen in, and our transversus abdominis is concentrically, which means shortening, concentrically contracted and pulling our abdomen in, that inhibits our diaphragm from being able to lower. If our diaphragm can't lower, then our diaphragm cannot synchronously work with the pelvic floor. And then we have to breathe up into the chest. That signals to our brain that we're stressed out, because when we use our secondary breathing muscles, that tells our brain our primary breathing muscles must be fatigued. And we're at such a point that we need to now rely on the secondary breathing muscles. That is meant to help us survive, because that's how you get away from a tiger. But
Yeah.
when we're breathing like this, just because we don't know any different, or because we are stressed out, our brain thinks there must be a tiger nearby. We're like in true threat.
Yeah.
But those breathing patterns don't keep us thriving. They just keep us surviving.
Right. And I think oftentimes as parents, right, we're in that like cautious mode. We're so stressed out. We don't even realize how we are breathing. So becoming aware of that, becoming a better co-regulator to help our little
Hmm.
ones through that process can be really important.
Yeah.
I wonder if you could talk a little bit about like the services you provide. I know that with the Pelvic Floor
Hmm.
Sucks book, you have a really great resource guide. I'm wondering if you can tell everybody kind of how you work. And I know you do
Yeah.
like cold plunges and saunas and all that good stuff,
Yeah.
because I'm also trying to help parents understand like how they would choose a chiropractor through
Yeah.
this journey, because I think there's a lot of amazing folks out there. And I've been learning with a lot of different people, but
Yeah.
just what things should they be looking for or
Yeah. So I
asking
think
questions?
I the population in general is underutilizing chiropractic. And, we could go down a whole rabbit hole of why that is. But there were actually smear campaigns against chiropractors for decades. And a lot of that was fear based, because chiropractors were taking away a lot of money from people going to their primary care provider and saying, "Hey, I have low back pain." And the primary care provider didn't really have any tools for that. And so then people were seeking out alternatives, and they found chiropractors and discovered that chiropractors is actually really, really helpful for any type of neuromusculoskeletal dysfunction. So, what a chiropractor does is not put bones back into place. If your bones are out of place, you would go to the hospital because that is an uncomfortable situation. Now, if I
So
come
we're not
across you
popping.
Yes, if I come across you and your shoulder is dislocated, I can reset that for you. But it's not something I do on a daily basis, because what I do is I actually find joints that don't move well and I help them move better. So sometimes joints are not moving well because they're restricted and they're not moving enough. And those are areas that we apply an adjustment to. An adjustment is simply putting motion into a joint and ensuring that we can reach more ideal movement with that adjustment. So sometimes that makes noise, sometimes it doesn't. Chiropractors can use a variety of different things. Chiropractic actually means by the hand. Like that's what the word in its Latin roots actually means, by the hand. I use my hands as a chiropractor. Some chiropractors use tools. Some chiropractors strictly use the table and like kind of drop pieces that are associated with that. But and that's neither here nor there. I think that people in general can just find a chiropractor that resonates with them, because I'm a very okay loquacious but direct, right? So I use a lot of words, but I am directly telling you, you must put your baby on the ground. You need to stop giving your baby a pacifier. And some people don't like that sort of direct, I have to take control of my health sort of approach. I personally believe that the only person who can take control of your health is you. And so, because that is my personal belief and how I live my life, that is also how I practice. So, I'm there as a guide for my patients. And I apply manual therapy, meaning, like using my hands and putting them on a patient. If what you're expecting is that I am the person who's going to fix you, that doesn't really work, because this, to me, is a relationship that we enter into. Some chiropractors, you come in, you get an adjustment, and you leave, and it's more passive for the patient, right? The patient comes in, they receive an adjustment, and they leave. When you leave my office, you leave with homework. And so that's not right for everyone. But for babies, the homework is with the parents. So if a baby is not rolling to the right, then I know that baby's hip socket is not going to form appropriately. And therefore, you need 4 doses of movement medicine throughout the day in order to remedy that dysfunction. And if you don't do it, then it's just going to cost you more money in my office, because we're going to have a lot more work to do, right? And I have no problem seeing patients more frequently because they're not doing their home exercises, but my treatment plans are based upon people doing some of their homework at home. So I do some soft tissue therapies. Not all chiropractors do that, but I've been trained in a handful of them, and they're just a bunch of 3-letter acronyms that no one knows what they mean except for people in manual therapy. But ART, it doesn't matter. I do some soft tissue release techniques. So when we're talking about soft tissues, we're talking about muscles and ligaments. Ligaments can't really be released quite in the same way that muscles and tendons can. And we're talking about fascia. And so I work with the body in that way. And then I also do therapeutic exercise. So DNS comes, like, basically the prescription is coming from a DNS lens. And so everything that I'm doing is trying to get this baby or this adult or this pregnant woman or this postpartum woman or this weekend warrior who busted his elbow on the pickleball courts, excuse me. And anybody is getting kind of a prescription of DNS based exercises. And we're trying to get all of them to be able to move in the ideal movement patterns that all humans have ingrained in their brain, regardless of where they were born, regardless of circumstance. We have this program in our brain. So some of the things that I'll send parents home with is, I want you to switch the way that your changing table is facing, because your baby is rolling to the left every single time that you change the diaper. And we need to get the baby to roll to the right. So I need you to flip that around, which is also going to be weird for you as a parent, because you're like, wait, how do I change a diaper on this side instead of that side? What do I do with my hands?
But it's good practicing for both sides of the
It's
brain.
very good practice. Yes. So finding a chiropractor who resonates with you, right? Some chiropractors are much more holistically minded than others. Some chiropractors kind of approach things from that hurts, this is the prescription, it's an adjustment or whatever. And some chiropractors are a little bit more holistically minded, and they're like, okay, I see that there's some amount of discomfort that's going on here. Let's kind of peel back a little bit and see why that might be happening, and then figure out where it is that we could intervene. And it might be in my office or it might be somewhere else. And they kind of like consider more of the holistic picture. And neither is right nor wrong, right? Some people are looking for, I want to go to a chiropractor, I want to get in and out in 5 minutes, and I want to be able to go back to work. I cannot be your chiropractor. My appointments for follow-up visits are 15 minutes long. So you can't be back to work in 10 minutes because I'm still working with you. And some people just want to go in and get an adjustment and be able to leave. And that's great, but that's not how I practice. I do soft tissue work. I do therapeutic exercise, and then, like you said, we also have a cold plunge. We also have infrared sauna. We also have compression boots. We also have vibration plate. We have a lot of services to be able to offer. Realistically, it's just, these are all services that I want in order to make myself feel as healthy as possible. And I figure I might as well let other people use them as well, instead of, just them sitting around my house. So I want for people to feel empowered. And I would say that that's probably a common theme for most chiropractors, is to help their patients feel better and then also know how to feel better. We're just kind of trying to make the world feel better one patient at a time. And I think, chiropractors who want to work with pregnant and postpartum women will typically have some additional training in that. Like, we get a little bit of it in school, but certainly not enough. And honestly, even like I took, I'm Webster certified, but that really just scratches the surface in terms of what is available for us to do for pregnant and postpartum patients. I actually teach chiropractors the Move Mentors Perinatal Manual Care course. I teach them how to do manual care for pregnant patients. And then I, also am a DNSP. So I do a lot of things for like I've taken the DNS Women's Health course 3 separate times just because I want to keep learning about how to better take care of these patients. So I just take it with different instructors and different times and learn new things. And um, I, I, I have found that what works best for most of my patients, and we do have research to back this up, is if patients are doing exercises that complement what it is that they're doing in their in-office care, and that we have a goal that we're heading toward, right? So sometimes that goal is, okay, right now you're soaking 3 pads a day with your incontinence. Let's get that down to 2 within the next 3 weeks. Now let's get that to the point where you actually don't even feel like you need to wear a pad. Now let's get to that to the point where you can't even remember the last time that you had any urinary leakage, right? And just continuing to set goals. If it's a baby who is having difficulty latching, it's like, okay, I want to do a short 3-week course of care and see, is this baby responding to the manual therapy that we're providing, or do I need to send them to another provider? Perhaps there's a little bit of a tongue tie, and maybe it is functional enough that this baby is not having other issues, but maybe it's not. And maybe we need to refer out, maybe for oral ACE or maybe for a revision. I do think that there are a lot of babies who are having surgery who probably don't need to be having surgery. Which I think it's important that we refer to tongue tie revisions as surgery, because a revision sounds like, a quick edit, but it is actually a surgical procedure for babies. And some babies need that, but some babies don't. And whether or not we are doing surgery, I think, is an important decision to be making. And I think it sounds more of an important decision if we call it what it is instead of making it sound nice.
That's an interesting perspective. I've not heard that, but yeah, it is what you're saying. So
Mm-hmm, mm-hmm.
great perspective. Now, if
Yeah.
someone is not local,
Mm-hmm.
how could they work with you? Can they work with you?
Yeah, so I have a couple of courses. So like I said, I teach with one of my good friends who is also a chiropractor and also a DNSP, is also a practicing midwife. She just loves all things birth, and so she went and did her CPM, and she now has a birth center in Wisconsin, and so she and I teach that manual care course for chiropractors, and then we have a couple of additional courses that are for parents. And so we have childbirth education classes, we have a postpartum rehabilitation course. The postpartum rehab course, I swear, like, Your Pelvic Floor Sucks and the postpartum rehab course are like my gifts to humanity at this point, because so many people don't understand that their pelvic floor sucks. They think that this is just like, oh, I guess this is just my life. No, that sucks and it needs to get better. And also, the only thing you know how to do with that is suck it up and in a Kegel, and it's not working for you. So, like, let's do something about this. And then the postpartum rehab course, thank you. Postpartum rehab course is 6 weeks of intentional DNS rehabilitation for the pelvic floor and the core. And then we also have some fitness and movement courses there as well. And then if you're looking for somebody who kind of practices like me, you can look for a DNS provider, which those you can find. You can find people who have gone through all of. So in order to be a DNSP, you have to have studied for a minimum of 3 years and taken a minimum of 10 courses and passed tests for 3 of those courses before you get invited to go to Prague. And then you study for a week and then you have to take another test. And so, they're grading us on our way through. There are lots more people who have taken DNS courses who just haven't gone through the whole certification program, but they'll usually have something about DNS on their website, talking about how they've taken those courses. I also teach chiropractors for the Motion Palpation Institute. So if you're looking for someone who does manual care with their hands in an intentional way, motionpalpation.org is another place to find chiropractors who kind of practice like me. And I think too, there's nothing wrong with going and having an initial visit with someone. We have had some patients who are just very honest in their initial phone call. They're like, I'm kind of shopping around for a chiropractor. We're a cash-based practice, so like we don't accept any insurance. If you want to come and pay me to have an interview with you, and during that interview, I'm just going to tell you what I find in my exam and give you some treatment, that's totally fine. I think there's nothing wrong with getting some amount of chiropractic care and kind of finding what resonates with your body as well as what makes sense to you.
Yeah. No, I think that's all really helpful. And I was going to say, this book has been such a great resource. So
Thank you.
much wisdom and insight. And I think that I'm going to share all the links that you've been talking about down below in
Thank
the
you.
show notes. But the resource guide for this,
Yeah.
seeing the activities that I need to
Mm-hmm.
continue practicing and doing my work, because I can see how this impacts us later in
Yeah.
the older years and, dealing with other issues and realizing there's other pelvic floor dysfunction, things that we have not been able to get into. And so we may
Yeah.
have to have another conversation.
I mean, I could
Uh,
talk about any of these things for days on end.
I love it. I love and see the passion, and I think it's just important. I think you've shared so much good wisdom and science behind how we move our bodies, why that's so important for our little ones, and really how that's going to impact their overall health and well-being in the
Yeah.
long run.
Yeah. Well, I
So,
appreciate that you're doing these, and I think it's such a great resource for parents. So I'm glad to be here, and I appreciate you, Irene.
yeah. Well, before I have you go, I want to do the
Mhm.
top 5 loving lessons learned. So I'm going to ask you some quick questions and
Okay,
then
let's see how quick I can do this.
let's see. It's all good. So what is your favorite product or service that you
uh, that I have to offer.
love? Like
Oh, that I
anything
love
that
for people. Okay, when you first asked that, I thought you were like that. But my favorite that I offer, that's harder than what I was
no.
prepared for. My favorite product for new parents is actually probably the Haka or Haka. I don't know how you say it,
Oh, the
but
Haka. Uh-huh.
yeah, Haakaa. That
Mhm.
for me specifically was so helpful. Not every woman can use it to pump, but even if you're just using it to collect milk, that's very helpful.
Yeah.
I could actually use it to pump. And I thought that I was looking at the Haka with like rose colored glasses because I had completely stopped using a pump and I was just using that. Well, then I actually set up, I was like, I'm going to do a test. I had been gone for 5 hours at work. I got home and my son was sleeping. So I needed to express milk. And I put the breast pump on my left breast, which was like my better producer. And I put the Haka on my right. And I just sat there and I got more milk out of the Haka than I did out of my breast pump.
Very
So that
interesting.
was really helpful, especially. So I had high lipase, which meant that I actually needed to scald my milk before I stored it, which translates to just more dishes, right? And the
Yeah.
number of
Well,
pieces
that
that
was
you have to
that's the
clean.
stinky milk, right? That's the
Yes. Yeah,
stinky.
yeah, yeah.
That's
So it's like a soap and like a bluish tint to it. So I needed to
mhm.
scald it before I stored the milk, which just meant had more steps. So the fact that I didn't have to take my whole pump, clean the whole thing, I literally just had this one silicone piece to clean. That was a huge
Yes.
game changer. And also just collecting that liquid gold. Any amount of breast milk that you can give your baby is such a gift to their gut health long term. There are bacteria that live in the gastrointestinal lining that are only fed by breast milk. So as soon as you stop giving that baby breast milk, those bacteria actually die off. That unfortunately for some women, that's not a possibility to continue breastfeeding. But even if you just give them a smidge of that golden ichor, it gives them such a great start to life. So even if you give your baby colostrum and breast milk never comes in or whatever other issues come up, any amount of breast milk that you can give them is such a gift. So having the ability to collect that, like if put the Haka on one side and nurse on
Yeah.
the other side and just like, oh, that's amazing. So that's
I
that's a
love
favorite.
I love the Haka. One of my
Yeah.
favorite postpartum doula hacks too.
Yeah.
What is your best self-care tip that
My
you do?
best self-care tip is to recognize how habitually you are already taking care of yourself twice a day, because morning and night, regardless of how tired you are or if you're traveling or if your in-laws are there, you brush your teeth. And so twice a day you can take care of this. So twice a day you can take care of yourself regardless of what's happening, and to just kind of almost give yourself the realization like I actually am caring for myself. On an ongoing basis, your cells are caring for yourself. So sometimes you don't have the space in your brain to be able to think of ways that you can care for yourself. And when you realize, like, oh, I didn't even think about it. And I did brush my teeth this morning. Go me. I did that. And I brushed my teeth last night too. Way to go, Lindsay. Right? Like giving yourself kind of the cheering that you need to recognize that self-care can be really challenging in the especially in the early postpartum time period, right? It's a
Mm.
huge shift for so many women and so many families. And recognizing, yes, I do need to fill my cup. I do need to put on my oxygen mask before helping others because now I have
Yes.
this person and I love them so much and I just want to take care of them. But in order to do that, I have to take care of me. And so, one of the first things that I teach women, one of the first things that I teach anyone is how to breathe. And so just taking a full diaphragmatic breath, meaning that the chest is not raising up on inhale, but actually 360 degrees, the abdomen is expanding outward on inhale. So, put your hands on your hips, so to speak. They're not really your hips, but, hands on your sides, and you breathe into all 10 of your fingers, including the thumbs in the back. You just did a little self-care, right? So if you do 10 of those breaths
Simple.
4 times per day, you'll downregulate your autonomic nervous system, which will then allow your brain to start creatively thinking of ways that you can care for yourself. So realize that 2 times a day, you're already taking care of yourself. And then 4 times a day, take 10 breaths on purpose. Your life will be better for it, because you're just, you're bringing yourself back to the present moment. That no one is going to be worse off for having done that.
Yeah. And it's so simple. And like we forget sometimes that it doesn't have to be so complicated.
Right.
Lindsay, what is something you never thought you would do or say?
Oh, so many things. My dad did the Atkins diet when I was in high school, and I was like, I could never give up bread. And I have a serious gluten sensitivity, so I haven't eaten bread in a very long time. There are some gluten-free breads that aren't terrible, but I actually bake my own gluten-free sourdough bread, but I never thought that I'd be able to give up bread. And when I realized that I had a gluten sensitivity, I had to completely cut it out. And the only bread that was on the market that was gluten free was atrocious. It was like eating a stone that tasted bad.
Oh,
Like
so I
now
wonder,
we're in a
if you
different
could
place
share that
now.
gluten-free recipe with us.
Oh yeah, I'll send you the link for the gluten free sourdough.
Awesome.
But I mean, there are a million things. I thought when I everybody who hasn't had a kid is an expert parent.
Of course.
Of
Of
course,
course.
we're so good at parenting before we have children. I thought that I would like still be me, still be the same me. And I think that that's a really hard thing for a lot of women. Like, I'm not going to let this baby change who I am. But realistically, you have brain chemistry changes that happen when you get pregnant. And the same thing happens in adoptive parents, where we actually have brain chemistry changes when we find out that we're going to be a parent. So you are not the same person that you were before having a baby. And so I thought that I would be the same person who just also had a kid. And
Yeah.
I was a completely different person, truly, from the cellular to the metaphysical. I was a different human after giving birth. And so, one of the things that I encourage a lot of my patients now is to remind them that butterflies don't try to become caterpillars, because once you've progressed through this, there is no going back. And so, being cautious of, like I'm extremely cautious of saying about getting back to things, because we're actually moving forward or we're not. We can't go back. I can't go back to who I was before having a child. I can't go back to the body I had before I had a child. I am way stronger in some ways than before I had kids. And I I guess that was kind of the biggest lesson for me. I thought I would be the same person, and I'm completely not the same person as when I first gave birth over 11 years ago.
Yeah. No, I love that. And I love what you said, butterflies don't go back to being caterpillars. Like I've
Yeah.
never heard that. And that's so true. Like, right. We want to go back to the way it was, but we continue to evolve and grow. And so,
Yep.
yeah,
And caterpillars have great lives. They just turn into butterflies and then they have great lives too. It's the same thing
yeah,
with dragonflies. Dragonflies have a whole underwater life. Like, they're water creatures. And then one day they're like, wonder what happens if I climb up this reed. Look at that. I have wings and now I'm flying. And I mean, it's just their whole life is completely different than it was before they went through that transformation. Caterpillars couldn't fly before. I mean, I didn't mother before I had children, and that has completely changed me as a person.
yeah, so true. Yeah,
Mhm.
we definitely could have a whole other conversation about nutrition and all the things.
Right?
And so, what would you say your one big takeaway is that you want parents to know?
I want parents to know that if they trust themselves and they trust their baby and they aren't in a hurry, that their baby will be better off for them having those beliefs.
So good.
I also,
And
okay, one more thing. I also just want them to know seriously that convenience comes at a cost,
yeah, both are
because
really
it's
good.
convenient to have your kid in a car seat and not take them out of it, because it's inconvenient if your kid is napping and you wake them up when transferring them.
Yeah.
But that inconvenience is actually worth it for your baby's long-term health. So I had two. That was cheating.
Okay. You're totally allowed, all good wisdom to be shared. And as a business owner, what's one thing that you've learned in this entrepreneurial journey of yours?
That it's a continuous figuring it out. You
Yeah.
know, I've been in practice for almost 13 years, and so at this point I have like growth problems. Like it used to just be me in my office by myself. And that was a problem because I needed more patience and I didn't, I needed people to find me. And now people know how to find me, and they're, calling my office without me having to like go out and like physically drag them into my office. But now I just have different challenges. And uh I think that I love being the person who's leading my company. Um, I I don't think that being an entrepreneur is for everyone, and I think that's great. Uh, I think that a lot of people have rose-colored glasses. They think, like, oh well, once fill in the blank, some sort of arbitrary deadline. Once you've been in business for X amount of time, you're more likely to make it. Okay, well, yeah, are you making it? Like, are you happy? Are you enjoying yourself?
Yeah.
So, um, I've learned so many lessons being an entrepreneur, and I'm I'm just continuing to learn. I think that maybe if I had gotten my MBA, I might have like learned these things. But it's kind of like parenting. Like you could take a lot of courses and you could babysit your nieces, but until you
You
actually
get
have a
in it.
parent, you don't really know what you're doing. So I had no idea what I was doing, and some days I still kind of feel like I don't, but it seems to be working out okay.
So we got to get on the floor and do hard things.
Exactly, exactly.
And that is how it all works out. And so,
Yeah.
Lindsay, thank you so much for the great conversation, all the great insights. And like I said, I'm going to share all those links down there,
Okay.
and then we will have to have another conversation again soon. So thanks so
I'm here
much for
for
being
it.
here.
Thank you, Irene.
All right. Take care. Thanks for tuning into today's show. You can see all of the details and show notes below. And as you go out into your day, I hope that you'll make it your mission to be calm, confident, and rested as you lead today. Sweet dreams.